Hi, my name is Kate Russell. I'm going to be performing my skill of collecting a wound culture. The first three things I'm going to do is my general principles and safety practices, my 11 rights, and my 3 checks. I'm also going to use my 2 patient identifiers, asking their name and date of birth and matching that with their wristband. I am going to assess my patient for pain, and if they are in any pain, I will check the MAR and see what pain medicine I would be able to administer. I would assess my patient for allergies. So the first thing I'm going to do is do my hand hygiene and don clean gloves. And I'm going to remove the bandage using the push-pull method. So I'm going to pull around the edges, and you can use saline to loosen them up if needed. And then I'll pinch in the middle and pull up. And I'll also use the Taco method to assess the drainage and the wound. I would assess the type of drainage, the amount of drainage, the color of the drainage, and the odor of the drainage. I can go ahead and discard my old bandage. So now I'm going to go ahead and clean the wound. I need to take off the old gloves. Get rid of those. I'm going to do some hand hygiene. And I'm going to don clean gloves. Alright, I am going to take my saline and I'm going to cover my gauze with it. I'm going to take some of the gauze, wring out any extra, and I'm going to go from the top along the side all the way to the bottom, cleaning that in one direction. Discarding that, I am going to take another piece of gauze, go on the other side from the top to the bottom in one direction, tossing that, and one more right down the middle from the top to the bottom. Now I'm going to go ahead and dry it. So I am going to take my dry gauze, I'm going to go down the side just like we did from the top to the bottom. Discard that. On the other side, from the top to the bottom. And another one down the middle. Okay, I'm going to discard that, and I'm going to take off my gloves. I'm going to do hand hygiene, and I'm going to put on another pair of gloves. And I have my culture tube. I'm going to go ahead and take the cap off of the tube. And I'm going to take the swab out, making sure not to touch anything else, not contaminating it. And I'm going to go down the middle in a circular motion, not touching any area where the skin is intact. And then I will put it back in the tube, not touching the sides of the tube to contaminate it. And then I would fill out the side. I would put the area where it was collected, the 2 patient identifiers, their name and date of birth, my initials, the date, and the time. And we would send that to the lab. I'm going to take off my gloves, do my hand hygiene, place my patient's call light in reach, perform any assessments needed, and then report and record.